There's a psychology of quote unquote a little bit better. Patients and humans, we don't evaluate change very rationally. We don't necessarily plot our symptoms nicely on a graph. It's not mathematical in that sense. We often don't work through it objectively. So we go by feel, and we use reference points of how we used to be able to do things. Sometimes we go by feel or by stories, by whether today seems like it might suck slightly less than yesterday. So when someone says, I think it might be better, they're not just reporting data. They're running a risk assessment. They're deciding whether or not they see the light at the end of the tunnel. And that's the moment that we as clinicians need to lean into. It's not something that we need to fix. It's not something that we need to necessarily patronize them, but we do have to notice that those little comments and say, tell me more about that. Tell me more about what 5% means to you. But this is where most clinicians tend to screw it up. We dismiss the small wins. We say, that's good, and keep moving. Or worse, we go looking for more objective signs, range of motion, resisted strength, and ignore what's actually changed. It's the patient's internal story. The great clinicians, they catch that moment. We dig into it and say, what does that 5% look like in your life? And the answer is always something meaningful. I got out of bed without limping. I stood to cook dinner. I wasn't scared to lift my kid. That's not noise, like pain. That's not noise. This is the actual signal that we're looking for. So imagine if we, instead of pain scores, tracked how many stairs someone climbed without hesitation, how long they stood before shifting, how often they moved because they wanted to, not because they had to. The rehab world might look completely different. People would monitor more than just their pain. They would feel less anxious. They would tend to be more honest. They would tend to want to talk more about how they're actually doing. But because those metrics, they're hard to measure. But these are the ones that patients actually care about.